Some people look good with bigger eyes, some people look good with smaller eyes, but I find, to me, double eyelids are always more attractive just because it gives it more of a depth to your eye, and then when you add eyeshadow or whatever, it just looks better. Asian people are always looking at Caucasians like, oh look, their faces, they have double eyelid, blah, blah, blah. But in Asia, at the same time, because of all the celebrities having double eyelid, they want them too. So I think at both places it's pretty popular. I did my research. He has 12 years of experience. He's also a facial plastic surgeon, and he specializes in Asian eyelid surgery, so I'm pretty comfortable with him. I am nervous, but pretty excited. I mean, I've been wearing double eyelid tape since high school. I'm so tired of wearing it, so I can't wait for it to be over.
So Lexi, you've come to see me to talk about double eyelid surgery. Yes. Now, do you have a fold in your eyes sometimes?
It's not always there, and then sometimes it goes higher, sometimes it goes lower, sometimes it's not there at all. It's just, yeah.
Now, with the height that you have, I can sort of see a little bit of a crease that's forming there now. Do you think that if we could make a crease for you at the same height on the other side and have them both be permanent?
I would prefer it to be higher.
Higher. So simulated height now we've done at 7 millimeters, and I think that looks good. Any questions?
I am diabetic, and I was wondering if that would affect anything.
Not a problem. This is a very minimally invasive surgery, if you know, that's often a term that people use. We're actually just putting some very, very tiny incisions, so the healing process should be very good. I don't think you're going to be impaired by that at all.
Would you suggest putting on any cream or anything?
No, in fact, I think the important thing is not to put anything on the lids. Don't put a lot of makeup on, don't rub the lids, and make sure that you don't wear contacts for a little while.
Yeah.
I usually tell people 4 to 6 weeks. The main thing is we just don't want you sort of pulling on your eye to get the contacts in and potentially breaking this very, very tiny suture. So Lexi, it's been a week since your double eyelid suture procedure, and things have gone well. I understand you had a little bit more swelling on one side, I think, than the other?
This side, yeah. But it's gone now, but it's just the bruising left.
What I'm going to do is I'm going to measure the height of the creases because I want to sort of compare them when we see you next.
Sure.
And also compare them with the height that we had marked during the surgery. Perfect. Yeah, they're exactly the same on both sides, which is great. You know, with your eyes open, you have a really nicely formed crease. It's been a week, so you know, usually with incisional techniques, we would expect to have a lot more swelling, and you certainly wouldn't look as good as you look now.
Oh, awesome! I think my results were really good. My eyes are actually pretty big now. I feel awesome. I don't have to spend so much time to get ready in the morning. That I don't have to waste like 20 minutes trying to stick on the tape or like angling it wrong and all that. During the surgery, I couldn't feel anything. So to me, I was just like lying there, I'm like, okay, sure. Yeah, it was over really fast too. I did swell up a bit for both eyes. This eye is still actually a little bit bruised still, but it's going away. I would tell them to go for it because it does make you feel pretty great knowing like you don't have to, you know, put so much work into your eyes, and then knowing that you can wake up looking naturally like this, you know what I mean?